Dr. Vijayan, how are you today?
I'm well, thank you. Thank you so much for having me.
Absolutely, our pleasure. I told people that I was having an infectious disease expert on the show, asked if there were any questions they would like me to ask. Most of them were centered around vaccine hesitancy, including distrust in the vaccine's quick rollout, being sure how COVID-19 vaccinations will work in the future. Is it going to look like a yearly flu shot? I imagine that you, as the infectious disease expert extraordinaire, are hearing a lot of this right now. Is there any overarching message that you want to give to folks who are struggling with vaccine hesitancy right now?
Yeah, I mean, I guess first of all, I would say it's okay to be afraid. A year ago, I was terrified when this brand new virus came to our world, and I had no idea how to treat it. I will say that a year later, there are still things that I don't know, but there is actually a lot that we do know, and a lot of wisdom that we've gained in the span of now 12 months. And one of those things is are these vaccines. And while the technology is new to us, it actually is technology that's been studied for a couple of decades now. These are things that brilliant scientists, way smarter than me, have worked on for a long, long time. And they took the opportunity to really look at this right when this pandemic hit. They were up and running. And, with the help of amazing human beings who volunteered to take part in these studies. So there are 3 studies that we now know of with the 3 vaccines that are out, each of which have had 30 to 40,000 people that took part in those studies. We've discovered 3 great vaccines that work. They work in preventing people from getting infected. They work people from getting sick enough to go to the hospital. And this is exactly what we need to get us out of this pandemic. These are our goals, to get people to try to prevent infection, to try to prevent people from getting sick enough to go to the hospital, and to try to resume our lives and get back to normal. So I'm really, really optimistic about the 3 vaccines that are out there right now.
So, as an expert in infectious diseases and a parent, how do you feel about getting kids back into schools while trying to mitigate the public health risk?
Yeah, it's a great question. I mean, I will tell you, I've been a big proponent of getting kids back into schools for a long time, and we've had a lot of support from our pediatricians. The American Academy of Pediatrics has also really been strongly proposing to get kids back into school. Kids are not doing great on Zoom. My one kid who had to go on Zoom was really struggling, and he had all the resources in the world, right? I mean, we're very privileged. I acknowledge my privilege. I have an incredible woman who helps me care for my children when I'm at work. And despite all of that, it's really hard. They just aren't getting the same kind of education. They're not getting the same kind of social interaction. I will say both of my kids, actually, I have a 7-year-old and a 4-year-old, and they've been actually in a school setting since September. So my 7-year-old actually was basically going to what was his after school program, but it was there for the whole day, and he was able to do his Zooms there. And then in December, actually, my school district opened. Even though we were at the height of the pandemic, they opened, and they implemented all the right mitigation measures. All the kids have been masking all throughout. They're doing their distancing. They're doing all of the high touch surface cleaning, and all of these things, honestly, have really worked tremendously all throughout. We've had no cases of in-school transmission at all. So I'm I really strongly believe that we're in a good place now with vaccinations rolling out, and hopefully we can get more teachers vaccinated as well, that kids should absolutely go back to school.
Right on. So, one thing that a lot of folks have said since the beginning, you heard a lot of the flu cases are just being labeled as COVID for the past year. You said in a recent article that you haven't seen a patient with the flu since February 2020. Now, my question is, are you part of a government conspiracy, Or did we get rid of the flu this year with our masking and social distancing? And if you're part of a government conspiracy, you have to tell me, otherwise it's entrapment.
Well, I will tell you, I'm not part of any conspiracy. I will tell you, I probably would get paid more if I were part of some conspiracy. You were welcome to look at my tax records. I have nothing to claim. But genuinely, I think that our mitigation efforts have dramatically reduced the number of flu cases that we've had in the last year. Flu does tend to affect different demographics. It does tend to affect children more than COVID tends to affect children. So, that probably has something to do with the fact that we're not seeing as much flu. But no question, the masking, the distancing, all of these things have helped tremendously.
Yeah, I know. I have a special edition immune system, so I generally have at least one bout with the flu per year. And I was just realizing I have not been sick since last year, like since getting into my social distancing. And I think that's for me, when I saw people making that argument online, they were like, well, they just turned the flu into COVID cases and did it. And it was like, well, I can tell you, I'm at least a -2 flu cases in the statistics. So it was really interesting to come across that article and see someone who works in the field having the same kind of observations that I was having. So you. And that brings me to the next point, right? The politicization of science. You recently wrote an article for BMJ about the politicization of science and public health interventions. So the big question that I'm just going to set on your shoulders and yours alone: how do we untangle science and politics?
It's such a tough question. And honestly, I think where I would begin is by sort of acknowledging that politics is not always humble. There's not a lot of humility in politics, but there is actually a lot of humility in good science. And by that, I mean that, scientists and physicians are okay with being wrong sometimes, right? And it's a process, and the more information we get and the more evidence we get, the more comfortable we feel in making certain decisions. If I sort of look back at how all of this has played out, you sort of look back at some of the treatment options that we've had available. So one of those treatment options that we were considering was a drug called hydroxychloroquine. Very early on, hydroxychloroquine became a politicized drug. Our former president was really touting it as a wonder drug. But then we had these great scientists who were willing to take the chance on testing this, even though they weren't sure if it would work or not. And they enrolled thousands of patients who were willing to take the drug, even though they weren't sure if it worked or not. And they discovered that it actually wasn't effective. And they were, and for them to sort of go out on a limb and trial a drug that has, ultimately had no benefit is, they knew that it was an important thing to do and an important message to get out and an important thing to publish. And so, I sort of encourage people to remember that when we're trying to do good science, we're not trying to win any favors. We're just trying to figure out what's the right thing.
Sage advice there. I love it. So I have one more question for you, and it is the question that we ask everyone that comes onto this show. Where is your joy coming from currently?
I mean, without fail, it's my 7 and my 4-year-old, hands down. When I put them to sleep, especially when they're sleeping. Just kidding. They're my joy all the time. But when I'm looking at them and looking at their amazing faces and realizing what the world has to offer for them, that is where I find my joy.
The wildlings, I think I saw them referred to.
They are my wildlings, indeed.
Beautiful. Well, half the internet watches this show every Monday night. So, do you have any final words of advice for the half of the internet that will be tuning in tonight?
I would just encourage people to listen to the science, to find those people whose wisdom you believe in, and just try to keep everything honest.
Mm-hmm. Well, thank you for joining us tonight, for coming through and being one of our enlightening and enlivening guests here on Masked Up. And just stay healthy, and all the best to you and yours.
Thank you so much. I really appreciate it.